Salish Matter is a huge YouTube legend, maybe the GOAT. We filmed a video together before, and we're gonna watch some of her medically accurate and inaccurate videos. Let's get started. All right, you ready to become a doctor, Salish, or what?
Yeah.
The scrubs still fit, and they age well, right? I don't think these are new.
What is this? You gotta look the part. You want some scrubs?
Yeah. Wow.
High level editing.
I think I have a better idea.
What?
Oh,
Okay, that's cute.
I've been selected as the patient for the day.
I like his shirt. That's a nice sweater. A little chest compressions, chest compressions, chest compressions.
Salish, you have 2 minutes, and the challenge starts now.
Do I get to shock him?
No.
That was a thermometer, Salish. Do not shock with a thermometer.
You do chest compressions first.
1, 2, 3, 4. 1, 2, 3.
Did you call for help?
Remember, steps, you check if they're conscious, if they're breathing. If not, you're calling for help and you're pushing hard and fast in the center of the chest.
Check his pulse.
Ew. No.
Why did she say ew? Salish, you have to check if he has a pulse, because if he has a pulse, you don't need to do the chest compressions. And I don't like Salish's position right here. She needs to be more on top of him so she actually can leverage her body in order to push the chest. You need to get at least 2 inches of compression.
No, don't do it. How do you know if he's alive?
Yeah, you don't want to hit your patient unless you're trying to do a cardiac thump. Works in Hollywood all the time, but in real life, it's rarely used, maybe in some really rare cases. So don't be going around hitting people.
He's alive.
You brought him back. Good job. Yeah. Those were some of the worst chest compressions I've ever seen.
Literally the worst.
But there was a lot of effort. The steps were taken in the right manner, so I'm still giving Salish a pass.
This is passing? What do you have to do to fail?
She didn't shock you.
What would be the failure if she didn't do chest compressions? That is the takeaway. If you do chest compressions, even if they're awful, after calling for help, you're doing the right thing.
Student Dr. Salish, are you ready?
Yes.
We are about to perform vitals.
What's that?
You're gonna check the patient's pulse, blood pressure.
Ew.
Why did we turn this into a military?
What is the number? 150 over?
97.
His blood pressure is a little high. He's been running around.
You've
He's
been
a little
stressing me out over here.
So this is a terrible way to do blood pressure checks because when you do your blood pressure check, it's supposed to be your resting blood pressure. So it should be after a period of time where you've relaxed, not been talking, not just ran into the office, not just had your daughter punch you in the face over and over again. Salish, I'm looking at you. We need at least 2 separate visits documenting elevated readings at rest before we make the diagnosis of hypertension.
You need to check his temperature because if someone's temperature is high, they have a
Fever.
yes.
Which means that they may have an infection. Viral, bacterial, rarely fungal, I guess parasitic as well. But there's also other reasons people have fevers. Autoimmune conditions, cancers, way more rare.
Which means it's a sign of a
Thing.
thing, infection. Not in the eye, not in the eye.
The one she's using is a forehead thermometer, so it's a little bit of a more superficial reading and you kind of do a little swipe.
All right, student doctor, say you have 1 minute left. You still have yet to check his heart or his
Ew.
lungs using the stethoscope.
Why is she saying ew?
What are we hearing? Any murmurs? Any murmurs?
I like that she starts listening on the right side of the chest. Most people don't do that. That's actually the correct format there.
Ew. Bah.
But his lungs, go to the back. Ask him to breathe deep.
Breathe.
Why is she gagging listening to her father's heart and lungs? That is the love he has for her.
Ew.
What does it sound like?
Pretty normal.
Pretty normal. I'm gonna start doing that to my patients. They're gonna be like, what's wrong? I'm like, pretty normal.
Why is it gross?
Because it's him.
What kind of doctor are you training?
She's too judgmental of a doctor. We need to help open up her mind.
I was at gymnastics and we were doing line sprints.
Oh no, what happened? Whenever I see a double black eye, I get really concerned for a skull fracture. Hopefully this is not gonna be as traumatic as that.
If you guys don't know what they are, it's like there are a bunch of lines and you have to go touch one and go back. You don't want to be known to be last. And the coach was like, 3, 2, 1, and we started going. And on like the second line, me and my friend, I turned this way and she turned this way. My friend and I.
Good guidance, Jordan, on the grammar. I wish you did that on the medical side too. These bruises look like they're in later stages of healing because as your body starts breaking down the blood that kind of spilled out of the blood vessels underneath the skin or within the skin, the colors change. So it goes from purple to red to blue to yellow. And that signals that these have been present for some time. Can we estimate with a good amount of accuracy how long they've been there? Nope. We've tested this and we're not good at being accurate about it.
So we were turning into each other and she turned into my eye and I turned into her head. And then I just fell on the floor like what happened? Am I dreaming?
You know what could also be bad? If she hit her nose, you could have a fracture there and the bleeding can be coming from the bone.
I don't think I got knocked unconscious. She was like, Salish, are you okay? And I was like, yeah, I'm fine. So then I tried to get up and I was like, nope, not fine. She only got like a little lump on her head, which is really good. And I'm happy that she didn't get hurt. But I got a black eye and I had like a huge bump on my forehead.
And what's interesting about bruising on skin is where the bruise appears might not be where the injury is. As an example, if someone gets a bruise on their lower foot, that can be an issue from a torn ligament in the ankle, which is higher above, but because of gravity, it pulls the blood down. So people will incorrectly think that there's a problem on the lower portion of the foot. So we don't actually know where her injury is just because we see the bruises.
I think she might have been in a little bit of a state of shock because you were smiling.
There's a lot of swelling there. I hope they put ice on the area early on. And I really say early on because afterwards, there's already no more bleeding happening and you're not helping the situation heal. And there are glands in the eye that if you're constantly exposing it to cold, they can get clogged and then you can have an issue with your glands. So cold early, but very short period.
Today we're gonna try to heal my eye with remedies from YouTubers.
YouTubers have remedies. Is she gonna try and get a cold spoon? It depends on the age. If it's early, cold spoon would be wonderful actually. If it's much later, warmth would actually do the trick because it brings circulation, helps clean up and break down some of those hemoglobin deposits and such.
There's tea bags sometimes people use.
Oh.
Tea bags are great for later on to bring that warmth.
This lipstick is awesome.
What does that have to do with healing your eye?
I want it to call attention to my lips.
It is about contrast. When they're doing movie makeup or we're looking at someone's health, we're oftentimes judging based on contrast. So she's using a very high level principle here to manipulate Jordan to buy her makeup.
Oh, Daddy, this has vitamin E in it. It will help you not look old.
Do I look younger?
I wish it was that simple.
I don't know if vitamin E can fix that face.
She's such a bully to Jordan. Why are you bullying Jordan?
Person taught me how to fight yesterday.
Here I come.
Honestly, we're gonna get her in the YouTube boxing match. Who would Salish want to fight? The Botez sisters? Michelle Carre? Michelle Carre versus Salish Matter. I would love to see that matchup. Who you got?
Gotta ice my eye.
See, those are better because somehow through movies or cartoons, people started putting steak on their eye. The bacteria that lives there, why? Why? Just get the peas or frozen fruits.
We're gonna do 3 remedies recommended by YouTubers. Number 1, tsunami.
Papaya fruit. Do you know what that is?
Eat it or put it on your eye?
Eat it.
Oh, yum.
I mean, I like eating fruits. I don't know if papaya is specifically good.
Next remedy comes from Matt Slade.
Well, get the swelling down, you gotta put a steak on it.
Bro, bacteria, stop it. Unnecessary, especially she has a wound there.
No. Lifeline, Darman. No.
Lifeline, what?
I'm a vegetarian, so I'll say use frozen impossible meat.
This is the vegetarian.
Okay, that's better. At least it's sealed. Thank you, Darman, coming in with some logic.
Thank you, Darman, coming in with some logic.
Next remedy is from Colin.
Okay, I'm going to bed. Good night.
But
Yeah, healing the black eye is partially about rest. She's doing the right thing, Jordan. You're the one spreading misinformation.
I really want to go back to gymnastics because 1, I miss it, and 2, my family is driving me crazy. My mom's okay though, so if I can complete 3 skills without my head hurting, I can go back to gymnastics.
That's partially what we do in return to play protocols. First, making sure cognitively they're okay, so they start studying, looking at the computer, then we can build up from there. Walking, jogging, running, sprinting, light contact, more contact, etc.
Number 1, jumps.
Wow, she's good. Talent.
Those are all jumps that I have to do in gymnastics and they all feel good.
Well, the question is how does your head feel, not how good the jumps are.
The next one is flips. Yeah, that one was fine. Now I'm gonna try a handstand. I'm really nervous because I haven't done this in a while and I'm scared it's gonna make my head hurt because I'm upside down.
I was worried that it might make her eye hurt because it would increase the pressure there. So if any of the blood vessels are still friable, which means that they're weak, more bleeding can happen. So I'm hoping it doesn't.
No, that hurt my head a lot. That means I can't go to gymnastics.
It's just another week delay. That's okay. You don't want to have a repeat concussion. The second concussion is always the worst concussion. Like, so when you rock your noggin, your brain inside your skull gets rattled. It sits in like soup inside the skull, so it moves. When your skull gets hit, the brain rattles and it really causes a lot of inflammation. So if you get hit again while it's already inflamed, that does lasting damage. So we don't want that for Salish.
I've been checking in every day to see if I can go back, and I'm still having pretty bad headaches, so.
So that's the problem. You don't want to be doing the testing every single day because then that could actually set you back. So you want to space the testings apart.
It's been 3 days since I caught needle, and I'm gonna try to do a handstand. If I can do it without my head hurting, I can go back to gymnastics.
And the bruise is already much better.
Okay, let's try. Oh my God, my head's not hurting.
Glad she healed up.
Today I surprised my best friend Needle, who was in a very serious accident 2 weeks ago.
Did the scooter hit the car? Did the car hit the scooter? Who hit who? I need to know the mechanism. If I know who hit who, I'd be able to make the at least presumptive diagnosis or tell you what I'm worried about.
He was in a coma for 5 days.
5-day coma? What I'm imagining is he had a head injury. And when there's inflammation inside the brain, sometimes we actually have to put people in a medically induced coma to decrease the swelling inside the brain. So I'm wondering if that's what happened.
The last thing I remember from the accident is me heading from Target and then stopping at the light. I don't remember what happened, but I'm saying what based off what people said. I was going straight, they were on the other side, they were making a left. Both our lights were green and I went first and then they cut me off and I went flying like over 2 cars.
Oh,
I
no.
got a broken leg,
Did you have your helmet on?
a broken collarbone, and a fractured skull.
See, I knew that there was a head injury. Broken leg heals, brain, oh man, you only get one of those.
They cut my head open and they like took like a chunk of like blood out.
Yeah, so remember, when your brain gets damaged, remember it's sitting in that soup, it rattles. If there's bleeding that happens inside the skull, that pressure builds up because imagine more and more blood is leaving the blood vessel, the little pipes that deliver oxygenation and nutrients to the brain. It starts entering this closed space and the pressure builds up and that could be damaging to your brain. So what we do in the hospital is we actually take a piece of the skull out, allow your brain to relieve that pressure. As time goes on, because we put you in a coma and we give you medications to lower the swelling, we put you in a specific position, we could put that piece of skull back, it heals up like all bones do, and that's probably what happened to my friend here.
I feel much better now. My leg is much less swollen. I can like actually function with my brain before I could not. Like I'm on a road to a fast recovery. Thank you guys
that's good
all
to
by the way,
hear.
for helping me and supporting. Whenever I woke up from the coma, everyone was so surprised I was alive. They thought I was gonna die. I was in the coma for 5 days. Everyone's like, oh yeah, Needle, you got in a crash. You've been in a coma for 4 days. I didn't believe anyone. I thought I was too good to get any crash.
Too good? He thought he was in a Darman video and they keep faking everyone's comas. It's like ridiculous, right, Rib?
For my head, it's gonna take like a year, but for my leg, it's gonna take like 3 months, 2 to 3 months, for me to like actually start walking again, like doing active. They said I can't like get knocked in the head one more time. They said if I do, I'll probably die, but yeah, they said even like a basketball hitting my head can like make me brain dead.
I would ask more follow-up questions about that.
Salish? Needle! Hi! What the heck? Wait, how did you get here?
What?
Okay, he sounded really surprised. They're both teenagers, so they're gonna be so chill about it. Like, hey.
3, 2.
She just bumped his broken leg against the wall.
Your new room.
No way. This is so cool. Wait,
Did she redesign his room?
yes, I gotta, oh my God. Thank you.
Of course.
Oh, thank you so much.
I hope you like
Bro,
it,
this
because
is
now
so
you have
pretty.
like somewhere to recover. I'm glad you like it.
I love it.
And there's Feastables in there. Look at that. We even got Mr. Beast branding.
You know how I get to control your life?
Yeah?
So you have to do my consequence.
Oh God, what is it?
I'm gonna bet that it took him longer than 3 months to function properly from an activity standpoint. Yeah, he may have been on his feet walking, but not to the same level that he was before. Probably took longer than that.
This is gonna be very good for your rehab. You have to go in.
No, an ice bath? No.
Get in.
I don't know how good that is for me. Oh, I hate cold water.
I mean, I can't even talk. Ice baths are overhyped. I like saunas better. I guess that's how I would put it. When you go into an ice bath for the first time, it feels like torture, and overcoming that has some benefits. Look, anytime you're overcoming a challenge, it's good for your brain. But the idea that like jumping in an ice bath is suddenly gonna make you anti-inflammatory, live longer, improve your hormones, it's overhyped BS. In fact, medicine has shown that hopping in an ice bath can actually slow muscle recovery and make it worse that you're not as prepared for your following game, practice, etc.
Ice baths are good for so many things. Long life, recovery.
She's overselling the ice bath. Sorry, Salish.
The longer you wait, the more ice goes in.
All the way.
Bro, you're just flexing now. Stop it.
Okay, one back. One more back.
Oh, that's a lot of ice.
If that's rehab, I'm never doing that again.
I don't think that needs to be a part of any rehab protocol.
You're gonna be a nurse.
You're joking. I've been.
Oh, nice.
I hate all kinds of sicknesses, and this is not very cute.
We actually watched her look at puke, and I couldn't get her to even go near the room. I put on a pink tutu, and she would not go into the vomit room.
And jump into the middle, split, and open.
What?
Hi.
Hi, how are you? I'm Rhonda.
I'm good. I'm Salish.
Tell me your experience.
I work with this really cool doctor. His name is Dr. Mike.
No,
I see you.
How do you know if he's alive? How?
Also, I have experience because I also pretend sick to skip school. So
This is like a Darman video within a Salish video.
In order to pass this challenge, Salish will need to find out which student is actually sick and needs to go home from school. The rest are all faking it.
Oh, that's not a bad challenge. Let's see if I can figure it out.
Hi.
what's wrong with you?
I just get migraines all the time, and after drama class, my head started hurting like crazy.
Go ahead and sit here, please. Can you see anything?
I mean, honestly, my head just kind of hurts.
Can you see anything? Does she think he's having a stroke? Is she trying to rule out a stroke?
What class do you have next after this?
I have math next.
What's your least favorite class?
Math.
So your next class is math, and your least favorite class is math. So
Coincidence? Maybe ask him about the symptoms he's experiencing to see if he'll tell you the truth, Salish.
all right, next patient. What's wrong with you?
I just threw up like 5 minutes ago.
Ew, I hate throw up.
Oh, that's not a judgmental nurse.
What's your next class?
Math.
What's your favorite class?
Math.
You can leave and I'll decide if you can leave school later.
This is hostage taking for students. If they're really sick and she won't let them leave.
Next patient. So what's wrong with you?
So I sprained my ankle, and then during drama class, so like I kind of like overused it.
What foot is it?
It's my left.
Your left, all right.
You gotta be careful. What if you're causing your patient more pain?
I don't have a cast anymore.
You had a cast?
It was pretty bad.
Okay, you can go.
She didn't even evaluate if there's any bruising, no range of motion testing. Make her stand up on one leg, come on. Where are you going?
Follow her. Bye.
Hi.
She was limping the entire time.
Evaluating a patient's gait is actually very wise. And I do it all the time, not because I think my patients are malingering, just to see if I'm missing anything. In fact, I just had a patient the other day, I believe he was 13 or 14 years old. He came in, said he sprained his quad muscle kicking a soccer ball. But then when I watched him walk, I saw that he had this pretty significant limp, and I was worried about a fracture, even though they weren't. Ended up getting an x-ray, avulsion fracture. Literally the muscle pulled off the bone. Thank God we caught it because I watched the gait. Gait means walk. Walk means gait.
Close your eyes. What foot is hurt?
My left foot.
You're right.
You're right.
Boot actually looks very used. So maybe you did actually break your foot, but like you just are using that as an excuse to leave. From 1 to 10, what's the pain?
Like a 7.
6, 7?
Like a 6, 7.
All right, thanks, you can leave.
We knew she had the fracture. Why are we sending her home now? Maybe we could medicate her and have her stay in school because school is cool.
But I hurt. I don't really know if I believe you.
Can you imagine if you went to the hospital and your nurse goes, I don't know if I believe you.
A few weeks ago, I was playing baseball. I swung the bat pretty hard and I tore my tendon in my shoulder.
Why does anything medical make Salish want to throw up?
So you were like, ow!
That is correct.
That sounds like a bone was breaking.
You go ahead and try push up for me. I just want to see if it hurts.
Oh, that's a aggressive trial. Maybe just do some passive range of motion testing, and then active just against gravity before you start making him do body weight exercise.
Salish might be laughing because she thinks he's faking it, but if she's wrong, I'm one step closer to winning the Matter Cup.
Or a malpractice lawsuit, Jordan. There's other issues at play.
You're struggling.
Well, my shoulder does hurt, so there we go.
I also don't love putting patients in a sling like this unless they have a very specific type of clavicular fracture. I don't know why he's wearing that, because sometimes you could develop frozen shoulder where the shoulder literally doesn't want to move. And it causes a lot of pain, and it takes time to break all that up.
Who do you think actually is sick and deserves to go home?
Well, not him. He didn't know how to put on his sling.
I want to be on this How do I, Salish, invite me next time for this competition.
I think it's one of these two people. I think her boot looks used, so I think it's her.
Will the real person who's actually sick and deserves to go home please step forward?
Wow, you make a diagnosis and you're goated? This is how I felt when I played Dr. Dole. It's a new medical guessing game. Click here to check it out. And as always, stay happy and healthy.